Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed annually in the U.S., with hospital stays anywhere from 2 to 4 days. With knees, the average age is 70. 60% are women. The infection rate is 1 to 2%. There's a risk of some blood clots as well. There's 90% satisfaction rates for knee replacement. 85% of them still work after 20 years. It is a quality of life procedure, same as hip or shoulder or elbow replacement. No one has to have one. Because the implants don't last forever, it is advisable to wait as long as possible to undergo a joint replacement. The implants are made of various alloys, including titanium, cobalt chrome, stainless steel, ceramic, and polyethylene components. So treatment option number one to avoid a joint replacement is activity avoidance. If you're doing an activity and it's very painful, then don't do it. Or do it less. For instance, if you're a runner and you've been a runner for decades, why not switch to swimming or to cycling or something that is cross-training and run less so it doesn't hurt your joints as much. Number two would be over-the-counter medications. This may include anti-inflammatories such as ibuprofen or naproxen, Tylenol, or glucosamine and chondroitin. There are some research studies backing up the benefits of glucosamine and chondroitin to help with cartilage restoration and stop the degradation. Prescription medications may include prescription pain creams or patches, high-dose anti-inflammatories that are not available over the counter, such as Celebrex, and short-term opiates for exacerbations. Number four would be a TENS unit. These are about the size of an iPod. They're battery-powered. They provide low-dose electrical stimulation through these foam pads that go over the skin, and it can change the way the brain perceives pain signals very nicely. Treatment option number five would be weight loss. Less joint stress means less potential damage to weight-bearing joints. For each additional pound you gain, that's 4 additional pounds through your weight-bearing joints. Okay, so it also works in reverse. For every pound you lose, that's 4 less pounds through your joint. So if you couple that with exercise, it can strengthen up the muscles around the arthritic joint as well, lessening pain. Treatment option number 6 is physical therapy. As mentioned, strengthening muscles around the joint will help take pressure off of the joint. Modalities may include ultrasound, electrical stimulation. Stretching is crucial to helping with your mobility. Treatment option number 7 is acupuncture. Several studies have looked at acupuncture for arthritic joints. Time and time again, those studies show significant benefit for all joints that have been looked at. Number 8 would be steroid injections. It's never been proven that steroids actually damage human joint cartilage. That actually was only shown in small animals. It was not repeated in large animals. It didn't show any issues. And humans, it's more of a theory than reality. These have been the gold standard for a long time. They're typically given every 3 months as needed. They don't alter the disease course at all. They're just really good for pain relief. Treatment option number 9 is hyaluronic acid injections. These are made from rooster combs, believe it or not. Our joints do contain significant hyaluronic acid naturally, and the theory is that they provide hyaluronic acid for pain relief, and it also promotes formation of cartilage. These have been FDA approved since around 2000. They do provide over 65% good to excellent results for 6 to 12 months. One study showed 80% good to excellent results for upwards of 6 months. Treatment option number 10 is regenerative medicine injections. These can include platelet-rich plasma therapy, which is using your own blood, and then you spin it down to, it has about 7 different growth factors in that, along with a high concentration of platelets. This has been great for joint pain relief. Stem cell injections include bone marrow or fat-derived and even amniotic fluid-derived stem cell therapy. There are more and more studies showing how well that these modalities work for pain relief, for avoiding a joint replacement, and helping increase a patient's function. So what are the outcomes? Most patients are able to delay or avoid the need for a joint replacement. While most joint replacements end up fine, there is always a chance of complications, and it is truly a quality of life, last resort procedure. Knee injections have over 75% good to excellent results. This picture actually says, "You are leaving pain, enjoy the journey." The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics in the network accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.